So this is my logic model worksheet. So the program title would be COPD readmission prevention through automated referral and enrollment process. The situation is patients with COPD are faced with gradual decline in health and quality of life after exacerbation. Research suggests that a self-management education program and care delivered by a dedicated team after discharge improve treatment adherence, coping strategies, and quality of life, while decreasing emergency room visits and hospital admission. So the inputs for this logic model are the emergency room, inpatient and urgent care team, the health education team, informatics and information technology team, transitional care team, health education team, public affairs, and hospital administration. The outputs of the program is the creation of a best practice alert in the electronic health record with links to the online self-management education program and a referral to care management team. Another output will be to train the ED inpatient and urgent care to take action to the COPD best practice alert. Also, the training will be conducted to the population care and transitional care team as they will do a focus follow-up focus on the completion of the self-management educational program. And lastly, another output will be the creation of a flyer to remind COPD patient of online classes and also to remind the staff of the program. And who are we reaching in this project? We are trying to reach for patients admitted in the ER, inpatient, urgent care with a diagnosis of acute exacerbation of COPD. As for the outcomes, the short-term outcomes would be patients will complete the online SMEP. Patients will acquire knowledge on the exacerbation prevention, risk, and medication management for COPD. Patient will learn coping strategies and skills to manage his or her symptoms. Patient will learn communication strategies, and a patient follows up with the care management team. Medium term is the patient follows medication, exercise, and diet regimen. Patient utilizes resources to improve lung function such as smoking cessation, interventions. Third will be patient will be able to manage the symptoms at home. Medium term outcomes would also be patient is coping well with lifestyle changes, and patient is communicating effectively with family and healthcare providers. And lastly, the patient completes the follow-up visits. Long term will be improved quality of life for the patient, decrease exacerbation episodes, decrease number of physician visits, and increase medication adherence, and of course, decrease readmission rate. The assumptions of the assumption of this project is that self-management education and post-discharge follow-up of patients with acute exacerbation of COPD will improve confidence in their capability to be able to manage symptoms at home, increase exercise tolerance, increase medication adherence, and effectively communicate with family and healthcare provider, and will reduce exacerbations. The external factors are patient learning capability and capability to change behaviors, patient's capacity to use virtual educational platforms, and the patient's access to the internet.